Hi everyone, I'm Tineke
And I'm Chloe.
and we are 5 times more. Welcome to today's episode. We've got a wonderful guest with us today. Do you want to introduce yourself, please?
Yes, of course. My name's Sujitha. I am an obstetrics and gynaecology doctor working in South London, and I'm the founder of a platform improving pregnancy experiences and outcomes for everyone.
Perfect. So not much.
Big fan of 5 times more. Colleagues, friends.
Yeah.
Happy to be here.
So happy to have you. Thank you so much for coming on. We'll just go straight in for people who just want to know the information. Today we are talking about ectopic pregnancies. So can you explain what an ectopic pregnancy is and how it differs from a typical pregnancy, please?
Yes, of course. An ectopic pregnancy is a pregnancy that is not inside the womb. So ectopic basically means abnormal place. So it's usually inside the fallopian tube. An ectopic pregnancy is inside the fallopian tube. So it's when a fertilized egg comes and it doesn't implant inside the womb where it normally is and usually goes into one of the fallopian tubes. Probably about 90% of ectopic pregnancy end up in the tubes. And there are other places as well that are also abnormal. So say 5% are called interstitial pregnancy. So that's still in the tubes, but in the tube, the side of the tubes that's kind of near the womb.
Okay, I didn't know that. What's that? What's the name of that?
Interstitial. I only say this on Friday. I saw 2 people with ectopic pregnancies. One was interstitial and one was in the tube. So, yeah.
So it's still in the tubes, but like basically in different places.
So on the tube, you've got different ends. You've got the ends that have got fimbria, like little things like this that you see. The fimbria like catch the eggs, and on the other side you've got the tube that connects into the womb. So on the side that's connected to the womb, if it implants there, so not actually inside the womb, but on that side is an interstitial pregnancy.
Okay, well,
so quite rare, but still a type of ectopic pregnancy.
Yeah.
We try to get an image up to show what people look.
Yeah.
Yeah.
Okay, great.
So the second question is, what are the common signs and symptoms of ectopic pregnancy that women should be aware of?
Yeah, I guess that's a good question. First thing I'd say is sometimes people don't know that they're pregnant. So the first time that they find out that they're pregnant, they find out that they're pregnant and that they have an ectopic pregnancy. So it can be quite a lot. But some common symptoms are you might have missed a period, and then you might actually have other symptoms of normal pregnancy, like nausea or having a sore breast, for example. But the kind of things we look out for that are kind of specific to ectopic pregnancy are having pain. So if you've got pain in your tummy, or if you've got any vaginal bleeding, or you've got kind of browny, watery discharge, or if you've got pain in the tip of your shoulder. And the reason why you can get it in your shoulder is some of the nerves that go through your diaphragm here also connect to your shoulder. So if you've got blood or irritation in your tummy, you can feel it in your shoulder. And then sometimes you can have discomfort when you're weeing or pooing. You might notice you've got diarrhea or loose stools. Sometimes you might feel like you're about to faint or people faint. Those are kind of symptoms you can have, but you can also see some of those symptoms you could have in a normal pregnancy, right? Sometimes people have a bit of bleeding in normal pregnancy. Sometimes they get a bit of pain. So it's a bit tricky. It's not your job to find out if you've got an ectopic pregnancy. Those are the symptoms you should be aware of. It's your healthcare professional to find out for you.
I guess that leads us nicely onto our next question, which is an ectopic pregnancy diagnosed, and what are the known risk factors that increase the likelihood of you experiencing one?
Yeah, so if you have a positive pregnancy test and you have any of those symptoms, you should have a transvaginal ultrasound, which is an ultrasound that looks at your womb through the vagina. So the probe goes through the vagina. So it's a small probe, but that's the best way to have an accurate view of it. And you can sometimes see an ectopic pregnancy through that scan. That's a clear way to diagnose it. Sometimes you might also see that this person has got blood in their tummy, and you can see that on scan as well if the pregnancy has burst. But sometimes you have a positive pregnancy test and we can't see a pregnancy on the scan, and that's called a pregnancy of unknown location. And if you're otherwise well, you'll just be monitored up, because it could be that the pregnancy is just really on and we can't see it with our eyes on the scan, or it could be it's an ectopic pregnancy that we can't see yet, so you'll be followed up. So you diagnose it usually on a scan, but even then it's a bit complicated because sometimes it could just be quite early on.
Okay, that's really interesting. I guess I have so many questions.
Does that make sense? Yeah, I'm trying to explain kind of how we think things through.
Yeah.
I wanted to ask, how many weeks pregnant are you till you go on the scan to realize you're not it's an ectopic pregnancy?
Yeah, good question. Usually it's between 4 and 12 weeks that people kind of present with an ectopic pregnancy, but we do use kind of the hormone level beta-HCG to kind of have a rough idea if it could be in the womb or not. But really, we go on how the person is feeling, what the scan shows, and if for an extreme case, someone was in loads of pain, they had a positive pregnancy test, and we couldn't see the ectopic pregnancy on the scan, but they're in so much pain, we might even think about going for a surgery to see if there's an ectopic pregnancy with our eyes. So it's not that straightforward. But yeah, usually you should see it on an ultrasound. And usually if someone is so unwell, that will give you a sign of what you need to do next.
Okay. So just to bring it back, what are the risk factors for an ectopic pregnancy?
Yeah, if you've had an ectopic pregnancy before, it means that the chances are increased by 10%. So it doesn't mean you definitely will. Most people won't, but there is a slightly higher chance. If you've had any previous surgery that's involved your fallopian tubes, or you've had any kind of previous surgery in your pelvis, if you've had previous infections, sexually transmitted infections like chlamydia or gonorrhea, and particularly if they've been untreated for a long period of time, a condition called pelvic inflammatory disease, PID, where sometimes you might have had infections in the pelvis. If you're a smoker, that can increase your risk. And then if you've gotten pregnant, but you have an intrauterine device or intrauterine system, so like a IUD, IUS, like a Mirena, it's obviously not that common that you're going to get pregnant because it's a form of contraception. But if you get pregnant with that in, then it is a slightly higher chance that pregnancy is an ectopic pregnancy. I think there are a couple of others. So fertility treatment. So if you're taking medication that helps stimulate ovulation, that can sometimes increase the risk of an ectopic pregnancy. And then, of course, there's age, which is not what people want to hear, because there's obviously increased risk, but we know that there's a higher risk for people of having ectopic pregnancies over the age of 35. I mean, this is the thing, the age. I've depressed Chloe. But remember, the thing is, with all of this, I think it's important to remember that most people that have an ectopic pregnancy go on to have like healthy pregnancies after.
Yeah, that's very true.
Look at you smiling now. I've got you back. Yeah.
That's really interesting. I didn't know about the pelvic disease and also any kind of other diseases like chlamydia and stuff. I didn't know that could contribute to ectopic pregnancy. To be fair, I didn't even know what caused it in the first place. So yeah, but it's still interesting to see.
Yeah, and it's important to realize that these are risk factors. So lots of people have an ectopic pregnancy and they don't have these risk factors. So when I have someone in front of me who's had an ectopic pregnancy, obviously there are things that could increase your risk, but sometimes this pregnancy was going to end up like this, and there's nothing that you've done to cause this, to kind of explain that.
To be fair, I think that was going to be another, not quite the questions that we had set out, but I was going to ask, can you just have an ectopic pregnancy without these risk factors? Can it just happen?
Absolutely. We see that all the time.
Right.
Yeah.
Yeah. And it's not due to anything anyone's done or anything, they could have done differently. It just happens. It's like one of those. Okay.
So I was going to ask about complications. So what are the potential complications if an ectopic pregnancy?
I haven't done that one. Sorry.
How is it treated?
Yeah.
How do we treat it? How do we treat ectopic pregnancy? There are 3 ways, really. One is conservative. So we watch and wait. So we wait and see if the hormone levels go down, and wait to see that you're remaining feeling well. It's important to say there's a huge spectrum in how people present with ectopic pregnancy. Some people are well and they can go home, and some people are unwell. Then the second method is medical management with a treatment called methotrexate. This isn't necessarily offered at every hospital, but it is a possible option for some people. And then the third option is surgical management. Now, it's important to say with all 3 of these options, there are specific criteria, which might mean that one is most suitable for you or why one might not be suitable for you. So it's not that these 3 are necessarily always applicable, but these are generally the 3 ways that we treat it. And with surgical management, for example, if the pregnancy is live, or you're quite unwell, or you're in significant pain, or there's blood in the tummy, in your tummy, then often surgical option will be the safest. And now the most common, when we say surgical option, what we mean most commonly is that we remove that tube entirely. And the reason we remove that tube is to kind of fully try and reduce the risk as much of it happening again. If sometimes you remove a part of the tube, there's still a chance then that an ectopic can happen again in that part of the tube. Very rarely when we go in with, it's a keyhole surgery, we go in and we always look at the other tube as well. And we look at the other tube. If the other tube is damaged for any reason, then we might try, instead of removing this tube, as the tube with the ectopic, we might just try and remove the ectopic pregnancy, just because we're thinking about future fertility. Is obviously not the best option, and there is that chance of recurrence, but we're thinking this is someone who wants to go on to have another pregnancy. So those are the kind of options.
Right.
You let me know if it doesn't make sense.
No, it makes sense.
Yeah.
People see our faces like we're really
You're both like quite serious. So I was just checking the
yeah, very interesting. No, we totally get it. And yeah, there's no instances of ectopic pregnancy surviving, are there?
It's not usually the thinking is that a pregnancy that is not inside the womb is not conducive to continue.
Okay. Okay.
I'm sure someone will find a video somewhere online.
Oh,
on the
yeah,
internet.
Like,
Excuse me. Yeah, exactly. But as a gynecologist, the thinking is that a pregnancy needs to be inside the womb to continue to be safe and healthy for both the baby and for the mother.
Yeah, no, that makes sense. So what are the potential complications if an ectopic pregnancy is not treated promptly?
Yeah, so we're talking about the spectrum of how people can present, and some people we manage them from home, some people we take to theatre. I guess the main thing that we are worried about, the main complication of us not doing anything, is that that pregnancy bursts or it starts bleeding, and then there's internal bleeding inside the abdomen, which can be very serious. And it's not that if there is bleeding, that is the most serious thing and you're going to die. We see bleeding all the time, but it's the further end of that spectrum if you're continually bleeding and you're not taken to theatre promptly. So internal bleeding, and very, very rarely, but very seriously, is death on the extreme end of things. But I feel like we should give some numbers so we don't scare people with, as soon as you mention death, that's the risk with everything, right? Let me think. The rate of ectopic pregnancy, if you had 1,000 pregnancies in total, 11 of them would be ectopic pregnancies. And then in terms of maternal mortality associated with 1,000, so if you had 1,000 ectopic pregnancies, how many of those relate to maternal mortality? It's 0.2. So it's very, very, very rare. And as we all know from the work that we've done with health inequalities, the people that are particularly vulnerable for that are those that have got difficulty accessing care. So especially recent migrants, asylum seekers, those who don't speak English.
Okay, all right, fair enough. So it's quite, death from ectopic pregnancy is rare, but actually ectopic pregnancy is not rare.
If it's recognized at the right time, the treatment for it is very straightforward. I was just saying to you guys, on Friday, I took a patient to theatre and we managed it surgically. The next day, the patient was home. So it's what we know how to manage it. We know what to do. It's just getting the right care at the right time. That's the most important thing.
Okay.
So it's accessing the care when you need to.
When you need to. Yeah. I guess it's the whole spiral of, right, you're pregnant, you think you're pregnant, you're getting the signs, then finding out if it is or if it isn't, finding a scan or not, or just getting to that place as soon as possible to manage it. That's
the thing. If you're pregnant and you've got pain or bleeding, you should seek help from your nearest early pregnancy unit. Early pregnancy, go to A&E.
Yeah, absolutely. Yeah, makes sense.
Makes sense. Okay, so I have a question. What advice would you give to those trying to conceive again after experiencing an ectopic pregnancy?
Yes, this is often the thing that we spend a lot of time talking to people about when they come in and they've had an ectopic pregnancy, because it can just be quite a horrible process that you've gone through. And then you're also thinking about, what are my chances of conceiving in the future? Now, I'd first go through kind of explaining what are your chances of conceiving in the future first, and then talk about some practical steps. So people often think, so say they've had a tube removed, they think that their chances of fertility have reduced by 50%. But actually it's thought to be a lot less, that the reduction in fertility is less than that. Now, there are different reports, but I say roughly that your reduction in fertility is about 15%. And the reason that is that when your egg is released from one of the ovaries, it's not actually connected to the tubes. But you know, both tubes can collect eggs. You know, those little bits that I was telling you, the fimbria that are like this. So even if you released an egg from the same side that the tube was removed, the tube on the other side can collect that egg. It's kind of clever. So that's why your reduction in fertility isn't entirely like 50%. Is actually just your chance of fertility will reduce a little bit, but it's not as bad as people initially think. Now, it is dependent on so many things, like how was your ectopic pregnancy treated? Was it conservative? Was it medical? Was it a surgery? What level of complication and complicated was it at that time? But also, you know, it's to do with your health kind of circumstances, like how old are you? Do you have any other health history that might be relevant? How often you have sex? That's a massive factor in your chance of conceiving again. And there are different kind of stats out there, but I would say there's something, I think, for someone who's had an ectopic pregnancy, 65% of those people are heavily pregnant within 18 months of that. And then some studies show that actually goes up to 85% over the next 2 years.
Just great.
So, yeah, so obviously there is this 10% chance of it happening again. But remember, most people can go on to have babies afterwards. And then in some cases where there is damage to both tubes, it might be that you need IVF. So it's not that you necessarily need IVF, but you might, but there are options there.
Okay. Thanks for clarifying that, actually, because you know, you just think, okay, well, if this tube is gone, then that's it, 50%. I can't, you know, that's very good to know that information, because
to be honest, when I found out as well, I was like, that's what I'd want to know if this was me.
Absolutely. It's not 50, it's 50.
Yeah, roughly. It's not, it's not. But there are some things to say about if you're trying to conceive, actually. If you're trying to conceive after you've had an ectopic, I guess there's two things to think about: the medical side of things, the emotional side of things. If you've had methotrexate, the medication, then it's recommended that you wait 3 months before you try to start again, some of the practical steps. And that's because methotrexate can reduce the amount of folate in your body. And remember, if you're pregnant, you're supposed to take folic acid because it helps your baby develop. So usually wait 3 months. And if it's not medical, you can maybe wait 2 periods after. And you might notice that your first period after an ectopic pregnancy is a bit heavier than normal, but the second one should be closer to what your periods are like. And also a sign that the hormones that should be working in the way for you to conceive are working like that. So that's the kind of medical side. And remember saying that often we operate in quite a straightforward procedure and the next day someone goes home, maybe 1 to 2 weeks to physically recover. But the most common thing that you will sit with are the emotional side effects. And that even if this was not a pregnancy that was inside the womb, you're still grieving the loss of a pregnancy, and that will take a different amount of time for every person, every couple, every family. So it's important that you can still recognize this as pregnancy loss. Pregnancy loss is not just a miscarriage or early miscarriage or mid-trimester miscarriage. It can also include ectopic pregnancy. And obviously you guys are doing work with, the 5 times more and SANS service that you've got for kind of counseling and baby loss. It still counts. So sometimes we use different words, but the way that we're processing loss it still counts, right?
And I was going to say we'll definitely put a link down below to the service that we offer. Tommy's and Petals. So thank you for that. I guess to round it up, what is one thing you would say to somebody who is currently experiencing an ectopic pregnancy or has gone through one before?
I'd say 2 things. 1, you haven't caused this. And 2, most people who have an ectopic pregnancy go on to have a healthy pregnancy afterwards.
And that's statistic.
That's it. Yeah.
Love that. Thank you very much.
So welcome.
Thank you to everyone for joining. We will see you in another episode.
Thank you.
Thank you.